12th December every year is observed as the Universal Health Coverage Day annually to promote health coverage for all, irrespective of barriers. This means that every person, no matter who they are, where they live, or how much money they have, should be able to access quality health services without suffering financial hardship. This, however, isn't the case in Nigeria.
The idea is to stimulate policymakers to begin to understand the importance of making sure that the citizens have good coverage in terms of healthcare and quality health for that matter, and then also make sure that the people themselves understand that they have to take up those services, and as well as advocate to their own representatives if need be, and their policymakers to give them that level of care that they ought to get.
We don't have political will. There's still lack of accountability and transparency in terms of disbursement of funds meant for health. You know, if we are still having all these problems and we are not tackling them, then I don't even see us making it in 2050.
The role of citizens as well as members of the private sector in achieving universal health coverage in Nigeria has been clearly spelled out.
It's high time actually that private sector also steps in.
The most important office in Nigeria is the office of the citizen. You know, it's not something that can be done alone by government. It's not something that can be done alone by private sector. It's not something alone that can be carried on by the people themselves. It's time the government starts looking at working with everybody, all stakeholders, to make sure that we achieve the level of healthcare we want.
The theme for this year's Universal Health Coverage Day is Unite for Universal Health Coverage. Now is the time for collective action. If Nigeria is to achieve the Sustainable Development Goal 3 of universal health coverage by 2030, no one must be left behind. From Abuja, Okemute Imonroa, STV News.